Hello everyone. Good evening. ಎಲ್ಲರಿಗೆ ನಮಸ್ಕಾರ. ಹೇಗಿದ್ದೀರಾ? For those of you who don't know me, I am Dr. Vinod Babu Virupalli. I am a consultant diabetes care physician at Dr. Mohan's Diabetes Center, Indira Nagar branch. Today we are going to talk about the importance of controlling the infections in diabetes. So I want it to be very an informal talk. So I'm not going to talk much about scientific jargon, confusing you, or research, quoting research articles that I do with the usual, doctor's talks. But majority of you, I believe, are patients or enthusiasts about diabetes, or if many of your family members may be diabetic. So you may be curious as to what this doctor has to say. So I want to touch upon those points today, and we are going to have a Q&A session in the end, wherein you can post all your comments here, and I'll try to answer those questions or doubts you have about diabetes and dispel some myths in the process, and to the best of my ability. Yeah, you can as well post your questions there. You don't have to wait till the end to post them. So please post whichever question you have in the comment box. I will answer once we finish discussing the topic. So without much ado, so you all know diabetes is a big problem in India. Many people, I can't think of nobody who is not aware about diabetes these days, at least in the cities. But do we know everything about diabetes? No, there are several deficits wherein we Indians are not able to achieve the health progress that Western countries have achieved a couple of decades ago itself. So what are those issues? We'll have to be aware about these things. So mainly starts with education. What is diabetes and why do we need to control it? And it's a disorder of the pancreas, just like our height, weight, and skin color is something which is determined by our genes. Diabetes onset is largely controlled by genetic history. If you have those genes in the family, not the disease. Sometimes genes may be there in the family, your parents might have escaped the disease due to several factors. But if you have the genetic predisposition, that is the most important factor which determines whether a person develops diabetes at certain age. So it can happen at age of 30 or even early also. The type 2 diabetes, what we are talking these days, is coming much more earlier. So previously it used to come above 40s and 50s, but there has been a tectonic shift in the way we consume food or the way we go to work and call it as work. So sedentary lifestyle, unhealthy lifestyle practices has preponed these diseases into earlier decades. So what happens when you get this diabetes in early stage is that we need to control it much earlier. So that's the most important thing about it. Definitely, excuse me, please. My daughter is disturbing. So when you have this diabetes coming in much early in the course of life, that increases the chances of complications in the patients, because the longevity is more, and chances for them to develop these complications in the 50s or 60s are very high, thereby affecting the productivity and thereby increasing the chances that it can affect the next generation's ability or financial growth of the next generation as well. So diabetes is that problem. So if you don't control, the blood travels everywhere in the body, glucose travels there and then causes damage to your cells all over the body. So these are the long-term complications, what we call micro as well as macrovascular complications. It doesn't cause any symptoms to you, or we don't have any tests which can detect it in the early stages. But yes, we have several screening tools, so we can identify before it becomes a problem. Mainly the organs, eyes, heart, kidney, and legs gets affected in this disease. And today the topic of discussion we are going to discuss is about immune system, how immune system gets affected. As you all have known, I think majority of you know that our immune system is mainly controlled by our WBC, that is the white blood corpuscles. And glucose is present in the blood, and this WBC also are affected by it. Continuously bathed in high amounts of energy, there will be some permanent changes which occurs to these the guardians of our body. So what happens is a permanent impaired immune response occurs in diabetes. So One classical example is during COVID. You might have seen, you might have heard over the last 2 years that diabetic patients are more prone for hospitalizations if they get COVID, and government, did not allow home treatment for patients if you have diabetes. So it's mandatory if they get COVID, they need to take consultation and get admitted to hospital. So age, diabetes status, hypertension, presence of heart disease, all these factors lower your immunity. So permanently, irreversibly. So that's something you need to worry. And if you are a diabetic, definitely you might have seen several of your friends or relatives having these serious infections. Infections tend to be much more serious and then requiring multiple oral or even IV antibiotics, be it a urinary tract infection, respiratory tract infection, or a genitourinary infection, or even simple fungus in the legs. It occurs commonly in diabetes because their immune system is impaired permanently. So this is an acute complication of diabetes. Uncontrolled diabetes leads to increased, when your sugars are very uncontrolled, it lowers your immunity during that time. And when your immune system is low, it leads to infection. So infection leads to high sugars, and high sugars leads to infection. It's a vicious cycle which we need to break. Not just at one point, we need to break it at 2 points, because one breaking the wheel at one axle will not work in diabetes. You have to break it at 2 points. One is, you need to control the infection by early initiation of antibiotics. Number two, antibiotics, again, they work only against bacterial infections. They don't work against viral infections. We have antivirals, which are not very effective drugs against viral infections. Immune system is the only protection that we have with viruses. And then the second spoke which we need to break in order to stop this cycle is where the glucose control. If sugars are very high, we need to initiate insulin, because during the periods of infection, insulin works well rather than relying on the other tablets. And then the infection will come down, the person's normal state of health is restored. So even though a person is managing the diabetes very well from the beginning, getting your HbA1c below 7.0 every 3 months, you are confirming that. Yearly once you are screening for complications of the eye, heart, kidney, and legs. So yearly once you need to do that. Despite that, infections can occur because we live in a society, a overcrowded one. In India, we have seen recently COVID-19 coming and taking away at least some of our loved ones and relatives or patients. So COVID has been the biggest pandemic of our generation, at least. But previously, influenza has dominated the world. Even when 100 years back, Spanish flu has killed millions of people over the world. So so in India, again, we have a very peculiar situation. Overcrowding is very rampant. We cannot prevent infections. We cannot be, even you have seen with COVID-19, even if you wear a mask and practice social hygiene, there is definitely, viruses has a way to overcome that as well, because of being present in the air for prolonged times and being viable. Then also they can cause infections. There is no guarantee that you cannot get infected when, even if you're following all the social distances. But with that said, the best thing anybody can do when especially with the talks about new COVID wave or new variants in the circulation in other countries and recent surge in COVID-19 cases, is to follow the social distance and then personal hygiene by wearing, when you're crowded places, wear your mask diligently. That will greatly reduce your risk, if not completely. So that's the single best way to reduce your risk of infection. But again, what else can diabetics do in order to reduce the chances of getting seriously sick with those infections? So yes, any infection, be it a viral, bacterial, or a fungal infection, can occur very more it occurs more easily, and it comes as more strong as well in diabetic patients because of the nature of diabetes itself. Being sugar, WBC are permanently impaired. The lymphocytes, the neutrophils, and other cells, the macrophages, which are involved in the defense mechanism, they are permanently impaired. So because of those changes, reasons beyond even we cannot understand fully, immune system behaves in a different manner. So when COVID made landfall, we have seen diabetic patients were more vulnerable to hospitalization, or even some of our patients have died. So and even when even the rates of complications are more, you have seen the black fungus when it occurred specifically in patients who are uncontrolled sugars, and it occurred only in India. As far as I know, it didn't occur anywhere else. So because of the rampant uncontrolled diabetes in India, it provided the grounds for this mucormycosis to worsen, because the fungus, which otherwise in normal people it is present even in water, so it doesn't cause serious infection in normal people. In uncontrolled diabetic patients, it caused extensive damage to the eyes and the brain. So that is the level of decrease in the immunity that diabetes produces. So what can be done to tackle such infections? We have thousands, or even lakhs of infections. We have viruses, bacteria, common infections, runny nose caused by several viruses, rhinovirus, adenovirus, and influenza virus, para-influenza virus. We get runny nose, we get well usually. But among this, there is one infection, influenza. This is the leading cause of death right now in India. Even COVID cases and COVID-related mortality has come down. Even before COVID-19, throughout the world, that was the number one leading cause of death in diabetic patients. So, among the infections, so cardiovascular disease continues to be the reason. If you don't manage your diabetes very well from the beginning, and these complications, slowly the blood vessels tend to accumulate the plaques, the cholesterol plaques, and over time increases the risk of heart disease and stroke. So with that said, there's a chronic complication. Diabetes needs to be there for a decade or two in order to develop such complications, whereas infections can occur typically during a short amount of time. So even if you manage it very well, this has the potential to change your life forever. So getting better from a flu with just fever and runny nose, or getting better from COVID with just minor symptoms of lack of smell and taste, or even fever for 3 days and then getting better in 10 days, is different than somebody who is getting admitted to a hospital with pneumonia and then going on to a ventilator. So this influenza virus also is similar in COVID-19 virus. It is a virus, so it tries to multiply in our cells. It behaves exactly the same, causes almost the same symptoms as COVID-19. Only thing is the mortality rate is at least 1/3 of COVID-19. So it's important, world over, all the organizations, WHO, American CDC, European Society, everywhere, it's mandatory to take the flu vaccine every year before the winter season comes in US. Everybody lines up to get the flu shot. In India, that awareness is not there because of multiple reasons. It is given as a part of insurance there. Here, we don't have insurance. Everybody needs to pay from the pocket. And when money is involved, obviously, government can't afford influenza shots for everybody in the country, as it did with COVID-19. That was our first time in our life we have seen that COVID vaccine being sponsored, at least for majority, by the government itself. So for flu, can be done because it's been there for over last 80 years, and it requires daily, at least yearly boosters. So that's something which our governments can't afford. So, and even doctors don't have time to discuss the importance of these, and tell them, hey, look at Thailand, look at Hong Kong or Singapore. Even smaller countries, they have these vaccination programs where everybody, irrespective of the age and diabetes status, starting from age of 6 months to the age of 90 years, everybody gets the flu shot before the winter season comes, so as to be prepared for with the new strain. Every year the influenza mutates and becomes a new strain, just like COVID-19, new variants will come. Your influenza also mutates every year, comes as a different variant, because we can never develop complete immunity against this influenza. It's been there since World War II, 1945 onwards. We've been having these pandemics all over. And one country starts, nobody can stop it because of the globalization. People travel from one place to other. They bring that without knowing, or even with symptoms or without symptoms, they carry it to the new population. And whoever didn't get exposed to that, their immune system sees it as a new disease and then responds accordingly. So that's where this diabetic patients are at loss. So even the normal persons, they develop minor complications. Very few of them develop complications, but the rate is very high in people with immunocompromised state like diabetics. So important. That's why, to get your flu shot, annual flu shot, even in India. So why are we not saying, if you may ask, like, doctor, you're saying that flu is such a serious disease, it kills people. Why are we not seeing it happen? So many times you might have heard about the term pneumonia, which is not responding to antibiotics. So it is because of this. It also causes pneumonia, means infection of the lungs, and thereby hospital patients will be going to the hospital, getting admitted to ICUs, requiring oxygen, putting on ventilator, But as they start the antibiotics that we have, higher antibiotics, meropenem, vancomycin, or even different categories, tigecycline and other amphotericin, everything, whatever we have at our disposal as per treatment, the patient is not responding. This is the reason. This word, when you hear like pneumonia which is not responding to treatment, usually influenza is the cause. Then why are we not getting that into the news or anything? Because there is lack of universal testing. Remember, we didn't have COVID-19 RT-PCR testing before the disease came, and government ramped it up during that time because of an emergency, because of the emergency, the nature of that infection. Whereas influenza has been there for a while, and we do not have an RT-PCR test for that. We have it, but it's not done in the general patients, only in ICU when we have a reason to believe that disease, on the CT scan, if we see that disease is pattern is a classic hallmark of viral pneumonia, then to complete for completeness sake, meaning to avoid doing looking for other organisms, we do the test H1N1 RT-PCR. So that will, if influenza A and influenza B will be there, and then in that the testing, if it comes positive, yes, we have a definitive diagnosis as to who is the culprit behind that. But again, the treatment doesn't change because viruses, there is no definitive treatment. Your immune system only has to act. You need to strengthen your immune system from the beginning, that is before the virus enters the cell. So this is where Indians do lack with respect to that. We don't have the top-notch hospitals for caring for very sick patients, and we don't have universal vaccination. All these factors make us more vulnerable than any other country. So India, Bangladesh, and Pakistan, Sri Lanka, this subcontinent is more vulnerable to flu every year. And many of our patients die in ICUs, and they don't even get diagnosed what is the reason behind this death, because of the lack of adequate testing here. So if you look, even now, if you just Google today, this is winter season. If you just Google in the news section in Google, you will see several new deaths happening all over countries, Brazil, North Americas, and even in Asia, other countries, several deaths, including pediatric deaths, are reported because of influenza. So it's important for you, just like we took the COVID vaccine, after that the third wave in 2021, whatever we had in January 2021. After, if you are fully vaccinated, you are teaching your immune system as to how to handle this. So your immune system will be like, hey, I have seen this person before, I know how to handle effectively. So if it is encountering the real virus for the first time, it can go haywire. It can go on an overdrive and then cause damage to your lungs and other organs. That's where the complications come. But if you introduce this virus in an inactivated form, that is meaning virus, a vaccine, then the immune system will know, will remember that from your previous vaccine, it will remember, it will have the memory cells, and then it will react in a much better manner. So it's because it knows the virus genome before that. So it doesn't lead to complications. So it greatly reduces 99% of the people. For example, I will tell you one example recently, what I've seen in my clinic. In the month of usually majority of my patients, 70 to 80% of my patients gets their annual flu shot in the month of August, September itself, because India, we get our share of new vaccine every year in the month of August, September. Western countries get it ahead because they obviously pour in more money to the vaccine development program, and they get their vaccine as early as April and May itself. So, but in India, we usually get it in August and September. And my patients get it. I suggest almost every patient. No consultation of mine is complete without mentioning about the importance of vaccines in diabetic patients. So when this patient, we were calling for follow-up in October, my staff were informing, this patient of mine, who's regular for at least for the last 3 visits, so couldn't come because of a death in the family. So we were inquiring as to what happened to this patient. He's 56 years old, and in Mohan's, we follow up every death occurs in our patient, to know the cause of the death and to offer any help that we can be to the patients. I believe that's the only organization which does in the private sector like that. So here, when we're calling, they were telling, the patient was admitted to the hospital with fever, breathlessness. And then I asked him whether it was COVID-19. They said that, they have done testing twice and CT scan showed a huge pneumonia. And once they were admitted to the hospital, they did the testing and found out that it was influenza. This was back in October. And after that, I have seen about 5 to 6 patients of mine who came back from hospitalizations and tell me, like, sir, I have been admitted with influenza. So in one case, they didn't find the cause. It looks like viral pneumonia. So many of times these tests are not perfect. So even if you test it, you need to test it at the right time, the right person. Even then, you can miss things. That's how medicine is not an exact science. No, 100% here. So viral pneumonia. So if you look at the X-ray classical viral picture, viral pneumonitis picture. So this one patient, I lost actually two patients in this year. So in this flu season, the last 2-3 months itself. So in my experience of almost 10 years of practice in diabetes patients, I have not seen a single patient dying of influenza after taking the flu vaccine. So because of influenza. So same thing with COVID-19. I might have treated around tens of thousands of patients, I would say, whether it's through Tata Health platform before joining Mohan's, or even during COVID-19, I might have given the consultations to other patients, or even to our own diabetic patients here. So I have treated thousands of patients here, and there, not a single patient has died if they have taken the two-dose vaccine with the proper of 2 weeks gap, and then get the infection later and then getting complicated. I have yet to hear or see such a patient. So it's important for all diabetics to take the COVID vaccine third dose, that we'll talk now later. First, once we finish the influenza, and annual flu shot costs about 1,500, 2,000 rupees, I believe. So 1,700 to 2,000 rupees. The price keeps fluctuating. That's the best investment, where you can, avoid the complications altogether, or even save from a financial standpoint. Also, this is the best investment for your health to protect yourself on an annual basis. So this patient of in question that I talked about, he's got admitted to a corporate hospital. Is a well-to-do patient. Stayed there in ICU for almost 10-12 days. Incurred a bill in lakhs. Paid up that money. Family had to pay up, and then ultimately lost his life. So this is the double whammy that patients experience. People who don't vaccinate, they don't understand the importance of these vaccinations. Okay, so yearly once, it's highly recommended to go, because there's a recommendation worldwide. Even WHO recommends the same. It's not my recommendation or Dr. Mohan's recommendation. WHO guides that all the patients who are in the vulnerable, that means diabetic patients, or should be vaccinated. Even children. It's not something, which a vaccine is not something which is developed in a haste. This has been there for 80 years, 80, oldest vaccination till date. So it's given to children. My 6 months old daughter got it, a couple of months back. So when she was 6 months, pediatrician recommended influenza vaccine. So common side effects, fever, swelling at the injection site. These are very common. The commonest are those. 95% of the people don't develop those. 5% only develop, and it gets better with paracetamol, just like we give paracetamol syrup to children when we give the vaccine. So that's something I highly recommend. So moving on to the second disease which we need to be worried about is COVID-19. Definitely. Why I spoke about COVID-19 second is India has a high level of natural immunity because of the infections that we got in the first, second, and third waves. So there is no need to be worried about this new strains that newspapers are flashing, BFF or XBB, all these strains. Those numbers don't mean anything if immunity is present at the herd immunity is present in a country. We have achieved herd immunity. We have reasons to believe that we have achieved herd immunity, but there is no need to be complacent. You definitely need to take all your 3 doses. That is 2 primary vaccinations, followed by the with the advised schedule of 4 weeks or 12 weeks, depending upon who you are, and then a booster is definitely recommended. Immune system doesn't remember these infections forever, unfortunately. We need to keep reminding it about this virus. So definitely it is a threat for everybody who is not vaccinated adequately. Please go ahead and take your booster or precautionary dose as advised by the government. And plenty of data is there in the public domain as well as in scientific journals to support its use. And it doesn't matter which vaccine you take, either it's Covishield or Covaxin, or there is a new one, Incovac, which is just nasal drops, not an injection. So it is supposed to be better at even preventing an infection altogether. So it works in the nose. It prevents it improves the immunity at the place where the virus comes and attaches to you in the first place. That's the nose and the mouth. So I highly recommend it. You can get any of these vaccines by registering from the COVID platform. If you've been complacent or didn't get the time, or you thought that cases have come down and I don't need to take this, definitely you should go ahead and suggest all your parents or relatives who have missed the third dose to take it as soon as possible, so that we are prepared for the worst. With that said, I don't anticipate another wave anytime soon, next few years also in India, because of the high levels of immunity and good, our citizens are obedient and took the vaccines, unlike other countries where they had these, questions and doubts in mind. So to be clear, I would like to tell you, the greatest invention of humans so far in this, I would say a decade or a millennium or 1,000 years is definitely vaccines. They are the greatest invention. I would place them, ahead of even man landing on the moon. So this is one way we have learned how to minimize the deaths. Because of that, we don't have polio, we don't have smallpox, which used to kill and paralyze our children before. So even several of our childhood diseases we used to hear, at least I'm in my 40s. So earlier when we used to see measles, diphtheria, pertussis, so all these things, even tuberculosis is coming down because of the vaccination only. So India is also in the phase where we are controlling the infections, and infections don't cease to be the main cause of death. So when overall hygiene has improved, overall knowledge has improved, rampant antibiotic usage, though it has its consequences, has improved our longevity in the last 1 or 2 decades. But there are some still, viral infections, that's mainly influenza and COVID-19, which we need to worry about and vaccinate ourselves with. So that's briefly about the COVID-19. And there is one more disease, very common disease that many of the city dwellers are aware, that is pneumococcal bacteria. So pneumococcal bacteria is again one of the very common and preventable infections. As I said, it's a bacterial infection. Yes, it responds to antibiotics. Majority do get better, but again, with that said, it's a preventable infection. It commonly causes the respiratory disease in children and as well as in adults with comorbidities, means diabetes, hypertension, lung disease, or any other condition which lowers your immunity. So what do we do? What should we have? In India, we vaccinate all our children at the age of 6, 10, 14 weeks, and then at 1.5 year with the same pneumococcal vaccine, which is definitely more expensive. Yes, it is available only in the private sector. Those who can afford it, definitely it's advisable to give it to their children to give it. And I see majority of my kids are vaccinated with pneumococcal. So what is the other group where this bacteria causes serious disease is our own patients, diabetics. So diabetics, anybody, smokers, lung disease people, these are the ones where the lung immunity will be less and the immune system will be confused as to how to act when this bacteria enters your system. So these are the patients who needs to take pneumococcal vaccine, but not like 4 times what we are giving in children. You can take only 1 time. So this, since it's a bacterial vaccine, bacteria doesn't mutate as often as what we see in viruses. So you can take only 1 time. It provides long-lasting immunity. Maybe you want to take a booster at the age of 65 if you haven't taken that pneumococcal in the last 5 years. Once you reach age of 65, because of the general diabetes, immune system will become weak. So you definitely need to consider a booster at that age. But yeah, at least 1 time in lifetime is what's recommended by WHO and international guidelines. So even the CDC. So with this, these are the 3 primary infections. And there is one more vaccine, hepatitis B, which is being part of their universal immunization program since the last 20 years. It was not part of our vaccination when I was, in school, around 1999. So that's when all the people were talking about this vaccine. And we had the recombinant DNA technology coming in, and they used to conduct camps where they used to give these 3 doses of hepatitis B vaccine, because till then we didn't know, it was not available. So hepatitis B is also one chronic disease of the liver. So it causes chronic active hepatitis, it causes damage to the liver, and then increases the chances of hepatocellular carcinoma, means liver cancer. So it's a deadly disease. It also lowers your immunity, predisposes to other complications. So it is a blood transmitted through blood and sexual transmission. So universal screening is recommended for people who are at risk. And this disease, again, simplest way to is to have vaccines. And now it is given at birth, on the day of birth itself, for all the children. many of the people who are elder than me, I would say, or even 30s, who are in their 30s, they didn't get it at the time of birth. So you need to do a catch-up vaccination. This is very much in the society. We see that almost on a day-to-day basis in our practices in hospitals and clinics, hepatitis B positive patients. So you need to take the 016 schedule. That means 3 doses of this vaccine. So if you take one vaccine today, the second dose would be after 1 month, and then the third dose 6 months from today. So that is the full schedule you need to. And if you are somebody who is diabetic and existing kidney disease, yes, you need to take a fourth dose as well. So, and you need to take double the dose of the vaccine so as to stimulate your immune system stronger. So that's something which you need to check with your nephrologist as to what is his preference with respect to the dose as well as the schedule what he wants to follow. So these are the 4 diseases all diabetic patients needs to be aware about. And other infections are also common. Urinary tract infections and skin infections, mainly the fungal infections, are also common in diabetics, which can fungal infections very easy. Simply keep your feet dry all the time. Always when you attend the toilet, make sure they are dry, especially between the finger web spaces, and keep checking them on a daily basis to see if there is any white color growth happening there. And always keep your diabetes under control to reduce your chances of having these infections. That's the best thing to do. So no vaccines required for non-life-threatening infections. Only the life-threatening infections, namely influenza, COVID-19, and pneumococcal bacteria, requires the vaccination. Other infections do not. We don't have vaccines actually for those. So that's the truth. And rarely they become life-threatening. So there are no vaccines in place for those. So whatever existing vaccines are available, please utilize them. Please talk with your physician. If you're not our patients, please talk with your physician or diabetologist and then inquire whether they are qualified, whether they need it. So it is done all over the world. Why can't you do it? So that's the most important message I want to give it to you people. So let's now focus on the question and answer session. I now request all of you to post any questions or doubts you have, any general doubts you have, and then I'll answer them in the Q&A box here. So I hope this session is useful, has provided some insights into how infections occur commonly in diabetics and what are the things you can do to minimize those risks, at least for some of you. And if you really like this message, please, pass it on, share it with your friends and family members who can benefit from this. All in all, we want to see our country's life expectancy to improve on all fronts, not just on the economic front or education front and the healthcare front. Increasing the longevity means managing these chronic diseases like diabetes, hypertension, cholesterol, thyroid disorders in a better manner, so that we'll add those extra few years to the lives of our patients and then as a country. So we have Dr. Ketan Verma. So what is the treatment for diabetes in the age 30 to 35 years? Again, it depends on the type of diabetes. We are broadly type 1, type 2, and then again, type 1 is when it starts with in the childhood age and then requires insulin only. Tablets won't work. And type 2 is where tablets work for majority number of years, and when maximum tablets are used till the sugars are not under control, we advise insulin. And there are again several different types of diabetes. Pancreatic diabetes 1.5, which behaves for 1 or 1.5 years like type 2 and then becomes type 1 later. So, and we have neonatal diabetes starting from the time of birth. So these are Modi type of diabetes. Several different types of diabetes are there. So for a person, I presume, who is aged 30 to 35 years, it could be type 2 or type 1.5. Type 1 is very unlikely. So I would definitely do a C-peptide level to see what is this pancreatic reserve. If pancreatic reserve is good, it means, I always use this example to my patients, always think about your pancreas like a lemon, with cut lemon sitting on the table, and you want to get juice from it. Yes, juice will not come out of it directly. So if you squeeze it with your hand, yes, lemon will produce the juice. What if your lemon is dry? It doesn't have that juice inside it. Then even if we stimulate with these tablets, the oral diabetic drugs that we use, the insulin production will not be there from your pancreas. So that's when what we call different types of 1.5 diabetes. So tablets won't work in such cases. We need to use insulin there, depending upon the patient and the fluctuations caused there. So Treatment depends upon the type of diabetes. So obviously, we need to evaluate as to what type of diabetes it's there. Especially an patient, we need to be very careful. We need to impart all the education about this diabetes. Somebody comes around and tells that taking these medicines will cause kidney disease. That's one of the most contradictory statements. Many of these relatives or people around us try to influence in that manner. Don't fall prey for those. If you don't want to trust me or anybody, please read about diabetes in authentic sources all over the world. People are having diabetes. Read from those, learn from those experiences, and then manage it better. Don't just hear says that medicines will lead to kidney disease. That is like saying taking COVID vaccine kills people. In fact, because of COVID-19 vaccine itself, we have seen very less deaths in wave 2 and wave 3. Wave 2, of course, was an exception because we had vaccine starting from March, and before everybody else could get vaccinated, we had a wave in April, May 2021. So that was an exception. So, but you saw the difference when everybody were vaccinated, looking at the scare created by the wave 2 in 2021. By Jan 2022, almost everybody were vaccinated, and even when Omicron variant of COVID-19 came, we didn't see much deaths in India. So that is one standing example without the need of any examples from science or doctors or advocacy from any doctors. People can trust the impact that a vaccine produces. So definitely, this patient who is in the 30 to 35 age needs to be managed according to the type of diabetes. And yeah, we usually start with the tablets. Tablets usually produce the response in majority. If they don't, then we have this census without waiting for months together and waiting for the response. We have this continuous glucose monitors, just like a sticker we attach to the arm, that will monitor the sugars on its own without causing pain for 2 weeks. From day to night, it will show how your sugars have been. It's January 8th, January 9th, January, graph wise. The patients can themselves look at it and understand how their sugars are going through every day. And then can we understand that whether the medicines that we started produce the desired response or not by looking at the HbA1c within 2 weeks. You don't have to wait 3 months and then take the decisions at that time. So it has fast tracked the management of diabetes, helps us quickly control the sugars of our patients, irrespective of what type of diabetes is it. I didn't see any patient going out of my clinic after 2 or 3 months time with HbA1c more than 8 saying that my sugars didn't come in control. So definitely there is all the patients I have not seen in my career any patient not coming under control. So it's only a question of using which treatment, either the tablets or the insulin or a combination of both at the right doses with the right person. So that's the skill all diabetologists have. Definitely you need to consult diabetologist when you're especially 30 to 35 young patient who has much more life ahead of you. Need to manage this diabetes, understand about this disease first, manage it better, then definitely it will add more years to your life. Thank you. Ms. Jacinta says, thank you very much. Very informative. I'm glad it helped you, Ms. Jacinta. And please pass it on, to other people who may benefit from this message. Thank you very much. Susan Margaret, good evening, doctor. My question is, pneumonia is majorly affected for diabetic patients. Yes, definitely. Not just pneumonia, urinary tract infection. The other day, I had one patient who had, came in with vomitings, and for 1 week there were vomitings, no fever. So urine test, when I was reviewing the records, patient was followed elsewhere. In October, I saw there are a lot of pustules, and then antibiotics were initiated, but the patient didn't do a urine culture. So I figured out that maybe this infection is causing, and then the patient is having nausea. On examination, there was when I thumped on the back of the right lower back, the patient immediately had pain. I had a suspicion as the ultrasound, and then ultrasound showed pyelonephritis infection, which has been lingering around, slowly and creeping it up. So we referred that patient for admission with IV antibiotics. That's something, which happens very commonly in diabetic patients. So not just those, and pneumonia is very, very common in diabetics. In fact, that's a leading cause of death among infections in diabetics. So it can be easily conquered if you take pneumococcal shot one time in your life, influenza vaccine yearly once before the winter season starts, and then COVID 3 doses as per the government. If you do that, 99% of these infections can be controlled, and then people won't die of these diseases. So with that, I can assure you that much from my practice of 13 years. Yeah. And Mr. Kaushik Saha, I'm a type 2 diabetic patient. Should I take pneumonia vaccine? Absolutely, without a doubt. That is the gist of today's discussion. pneumococcal vaccine is cheaper than even what we give to our children, that is Prevenar or other brands. So we have a cheaper vaccine for adults who with to reduce the chances of the same disease, what we call PPSV 23. For children, we give PCV 13, which is more expensive, around 5,000. This one comes at around 1,500 to 2,000 rupees. You take once, that pneumonia chance is almost down due to that bacteria. And then influenza vaccine yearly once before the flu season starts, preferably around August, September is when you need to take your flu vaccine to reduce the chance of getting a severe pneumonia from influenza. Those two, and of course COVID. We can never ignore COVID. So please be vaccinated with that as well. 3 doses mandatory. So that I hope that helps, Mr. Kaushik Saha. I think we have come to the end of this Q&A session as well. There are no more questions in the chat box. Yeah, if you have any few questions or comments or any feedback for this kind of lives we are doing, please feel free to share. So yeah, thank you, Susan. Thank you, Doctor. Thank you very much for you for being there till the end to listen to this talk. And we are Dr. Mohan's available. 51 branches are available across India. We specialize in diabetes care, and we manage patients holistically with respect to not just looking at diabetes. We control hypertension. We look for kidney disease in our patients. We manage cholesterol. We manage thyroid disorders. So we are physicians who specialize in diabetes. So we manage the patient holistically as a person, so as to increase the increase the longevity of the patient by reducing the complications from these diseases. You can feel free to approach any of our branches. I work at Indira Nagar branch, so I take care of this. So feel free to approach. The below numbers are there. 24/7 numbers are there to help you establish those appointments and schedule and get your blood tests. And all our centers are equipped with labs which give the results, state-of-the-art labs, I would say. We calibrate our machines every month in CMC Vellore. We send our lab samples and then ask them to give us a report every month. We monitor that personally, doctors. And, we give the quickest. One morning, if you give by afternoon, we get the reports and then you get to see the doctor on the same day. And all the facilities, even the pharmacy is present, the vaccines are present, the testing for the complications like eye and foot and other complications are also present in the same roof. All can be done at the quickest quickest possible amount of time compared to any other clinic in India or even abroad, I would say. So happy to share that we are well recognized throughout the world, and we lead in terms of the research publications that we produce in India and diabetes. So that is us. So yeah, one more question. I think 2 more questions. Yeah, Shankar Babu, any side effects will be there, doctor? Yes, any medicine, whether it's paracetamol, whether it is cetirizine, any medicine, any chemical that we take inside has adverse events. Similarly, vaccines also have adverse events. If somebody tells you otherwise, it is a downplaying there. Definitely, these vaccines have been developed, at least the influenza has been there over 80 years, and they are very safe to take. The benefits outweigh the risks in a huge manner. The common adverse events that I see in my practice is number one, fever. 2 to 3% of the patients tend to get fever. It usually short-lived, lasts a day or 2 maximum. So you can take a paracetamol, it will come down. Number 2, some of my patients are complaining of swelling, at the injection site, pain and swelling and redness. That also with hot compresses and if needed, paracetamol will come down. Of course, be wary that you should not take painkillers for any purpose. It increases the chance of kidney damage if you are diabetic. So we usually treat it only with paracetamol. So I have yet to see a patient who had adverse events lasting for more than 2 years, more than 2 days. And some people develop rash with this, red rash, which lasts a day or 2 because of the way vaccines work, their immune system reacts like that. But again, that also is a very short-term adverse event. For the majority gain that, reducing your risk of death from such a dangerous and widely available, widely present infection all over the globe. So it's a very easy trade-off. Yes, for the patients who wants to be informed, yes, these are the adverse events. And I have yet to see a serious adverse event from any of my patients requiring hospitalization from a vaccine in my career. So But with that said, it's possible. Theoretically, it is possible. But I have not seen in my practice, or in Mohan's, I haven't heard about anybody developing a serious adverse event due to these vaccines. Can pregnant women take these vaccines, Ms. Malati Ravindran? Yes, definitely. Live vaccines needs to be avoided, but influenza vaccine can be taken. Pneumococcal only, but again, any vaccine advice that you need to be taken needs to be discussed with your gynecologist. That's the best way, because pregnant women, they should be under the care of a qualified gynecologist, and depending upon the comorbidities, or in pregnancy, things can go wrong. Pregnancy induced hypertension can be there, preeclampsia can be there, or placenta previa may be there. So they will be better informed about the benefits that the women can get during the pregnancy, as opposed to the risks that the vaccines can pose. And then the patients can take an informed decision based on the advice by a qualified gynecologist. Yeah. So Shankar Babu, thank you for joining us, doctor. How often we need to take this? Yes, Shankar Babu, thank you very much for your appreciation. For that, we strive to work hard here in Mohan's. And yeah, how often? Yes, pneumococcal vaccine only one time in life. If you're crossing the age of 65, you need to take a booster for additional protection. That's one about the pneumococcal. For influenza, yearly once, before the winter season starts, that is in August, September, yearly one time. Why? Because the virus mutates every year, comes as a new person. It comes in a guise of another person where immune system can't detect. So yearly once, annual flu shot is highly recommended for all diabetic patients. And COVID, 3 doses, that we are all aware. So that's it. I think we have come to thank you, Mr. Shankar Babu, again for your nice appreciation. And I think with that, we have come to the end of our Q&A session as well. And thank you very much for taking the time out to join this evening session. And I hope the messages that you got from this helps manage your or your near and dear one's diabetes in a better manner, and hopefully leads to reduced complications, both chronic as well as acute complications. Thank you very much. Thank you, Ms. Malti Ravindran, for your comment.